Hi, my name is Sonia, and I'm going to be doing a straight catheter video. Okay. So I've washed my hands for 20 seconds. I've provided privacy for my patient. Hi, my name is Sonia. I'm going to be your RN today. Is it okay if we do your straight cath right now to relieve your bladder discomfort because you're having troubles emptying your bladder? Okay, is there anything you need from me before we begin? Okay, I will assist my patient in the dorsal recumbent position. I'm going to don my clean gloves. I've made sure I have the right patient, checking his bracelet, his name and date of birth. I'm going to wash with soap and water his penis, starting the cleanest area to the dirtiest. I'm going to retract the foreskin if he's not circumcised and clean. I'm going to make sure I completely dry all the areas, pulling back the foreskin, drying. I'm going to remove my dirty gloves. And I have my trash beside me. I'm going to gather all my supplies, checking the date, make sure they're not opened. And I'm going to open my sterile kit. And I have washed my hands after I removed my dirty gloves before I did this. I'm going to take out this. I'm going to position it under his buttocks in case anything drains out. I'm going to grab my sterile gloves. It has its own sterile field. I'm going to open my sterile gloves, only touching the outer edge, keeping them sterile. I'm going to don my clean sterile gloves. And now I'm sterile. I've made sure my patient is at hip level to work with. I'm going to remove all parts that I don't need during this exam. I'm going to open my iodine solution and pour it into the container. I'm going to get my lubricant ready for when I need it. I'm going to decap it now. I'm going to use these swabs with the iodine. I'm going to retract the foreskin if he's uncircumcised. I'm going to clean around the penis once and use my trash. I'm going to do it again, halfway down around the head. I'm keeping my dominant hand sterile. I'm going to do one more about halfway down the shaft. I'm going to I'm going to dump out my lubricant into my sterile field. I'm going to use my dominant hand that's still sterile and move my sterile field between my patient's legs. I'm going to retract the foreskin if they're not circumcised. I'm going to lubricate 5 to 7 inches, 2 to 7 inches of the catheter. I'm going to ask my patient to bear down as I insert the catheter with my sterile hand. I'm going to insert 5 to 7 inches. I'm going to ask them to bear down, and then I'm going to go 2 more inches until I see urine flow. I'm going to make sure the meatus is showing. I'm going to wait until the urine is done. I'm going to gently pull out the catheter, put it in my thing. I'm going to discard all of my dirty equipment. I'm going to clean off the iodine and clean his perineal area. I'm going to discard everything. I'm going to discard my gloves. I'm going to place the bed back to normal, lowest position. I'm going to give him the call bell. Ask if the patient needs anything. I'm going to wash my hands. I'm going to document my findings.